Let's Talk About Pain, a podcast from the Quebec Pain Research Network. In each episode, we discuss the latest advances in pain research with guests from across Quebec in the health and research communities. Enjoy your listening.
Hello, and welcome to the new episode of Let's Talk About Pain. My name is Amanda Sirois, and I'm a PhD student researching the psychological risk factors of chronic pain and substance use at McGill University under the supervision of Dr. Marco Martel. In today's episode, we are going to talk about psychological treatment for chronic pain, and I invited Dr. Louisia Starnino, a psychologist from the Allen Edwards Pain Management Unit at the Montreal General Hospital, to talk about it. We're very glad to have Dr. Starnino here today, who over the past few years has been working directly with physicians from the pain clinic to provide interdisciplinary treatment to pain patients, and has even sat with physicians and patients in the same room to supplement medical treatment with psychological treatment. And this collaborative effort has achieved very inspiring results. Hello, Louisia. Thank you for joining us today. Can you please introduce yourself?
Hi, Amanda. How's it going?
I'm doing very well. How are you?
I'm good. I'm doing well. I think you introduced me in a very high regard. I appreciate that. So, yeah, I'm a psychologist at the Allen Edwards Pain Management Unit. Have been since 2021. And I'm very happy to be here today and speaking to you.
And we're very happy to have you here with us today.
Mm-hmm.
So thank you once again for joining us. In terms of background, is there anything that you would like to share with us? How did you reach the point where you are today?
Well, you used the word interdisciplinary in your introduction to me, and I think that's a great one. I think when I graduated from my PhD and moved into private practice, I was missing this interdisciplinary piece in the work and found that working with patients is one thing, but sometimes, it becomes more of a, you can help patients on a different level when you're working with a team. And so I really was missing that in my practice and decided to come back to the public system and make a mark as best as I can here with our team, with our lovely team of nurses, physicians, physiotherapists, psychologists as well. And I'm very happy to be here. And that's sort of how I came across, kind of a feeling, when I, centered myself on what I wanted in my career, I just followed it and haven't really looked back since.
And we're very glad to have you here at the pain clinic with us. You provide a very nice and positive ambience to the clinic, and I'm sure the patients also really appreciate that. So currently, in terms of psychological treatment for pain, we often hear about cognitive behavioral therapy. What exactly is cognitive behavioral therapy, which can also be abbreviated as CBT? And what does treatment for this look like in the chronic pain management context?
Yeah, so we often hear about research on CBT and pain, or CBT and other symptoms or psychological symptoms. CBT is focused on reframing some harmful thoughts that a person might have that either lead them to or contribute to either disorders or psychological distress. And so the goal of CBT is sort of reframing. We want to reframe these cognitive distortions, right? If somebody is often minimizing how they're feeling or, comparing themselves or using generalization when they're experiencing the different thoughts, well, that might lead to various behaviors that might not be healthy for them. So that's something we're going to target in the room, right? If somebody's often minimizing their need for social support because they don't think they're worthy of it, well, that might influence some of their behaviors or the way they engage in the world. And so that's something we're going to work on in therapy, because ultimately it might be a contributing factor to their psychological distress or, take away from their well-being. And so CBT often will focus on this, and it's very different from other approaches that we might use as well, complementary to chronic pain management. So I don't know if you wanted to dive into that, but often physicians or even insurance providers will look for whether or not patients are receiving CBT specifically, but there's not only CBT to be used when we're dealing with chronic pain.
So you mentioned that insurance companies might be looking at whether or not patients are receiving CBT. What does that mean for the insurance company, whether patients are receiving or are not receiving cognitive behavioral therapy?
Well, I think, CBT has become this very interesting approach where we're trying to, as much as possible, standardize it. And so insurance companies like when we have a standardized approach and cover this, mind you, they can cover many approaches, but this is one of which I know for a fact that they often ask, are you receiving CBT for your depression or for your anxiety? And often patients are not sure what they're receiving as psychotherapy, which is sometimes part of the issue in itself. But this being said, that's not the only one that might be effective for you. And so it's finding out what works for you, as a patient, and not only focusing on one approach. There's so many out there, and you have to find out which one works for you ultimately.
So I imagine for patients, the therapy that they receive for treating their psychological symptoms and related to their chronic pain, it can vary immensely between each patient, and I imagine each one will have a very different plan. But in terms of a standard cognitive behavioral therapy, what does that look like? Let's say a patient hears that they're recommended to start CBT. What should they expect in general, in a very, very general sense?
Again, it depends what's the objective, right? Because chronic pain is often associated with other comorbid psychological issues. And so it depends what we're targeting. Is it that we're targeting kinesiophobia, which is the fear of movement linked to people who have, let's say, chronic low back pain or other forms of pain for that matter. And so, a CBT for that specifically would be to help them sort of change these cognitive patterns, these thought patterns that they have about movement, and expose them slowly and gradually, following their pace to movement, maybe accompanying by relaxation techniques or visualization techniques. And so that's something that you might expect when targeting this form of psychological symptom associated with chronic pain.
And in general, again, this might vary very, very much between each patient. How many sessions does cognitive behavioral therapy encompass?
It really varies. Often we look at, and it depends also on what is the person, do they have other underlying psychological issues, right? We hear often between 12 and 15 sessions, though sometimes it's a little more complex than that, and we need to add to these sessions. Depends what's available, what are the resources available for this person, what is the system, what are we able to offer at the pain clinic as well. And often I tell my patients, it's not about the number of sessions, but how much you're able to integrate what we're doing in the session, right? You can have less than 12 sessions and yet change, and you can have something like 90 sessions and not change, because that's not the focus of the session, or that's not where you're at, or there's no readiness to change. But, if we're looking at CBT in terms of really cognitive behavioral therapy manualized approach, you can see these chapters split up in 12 sessions or in, 16 sessions. But I think humans are complex and merit not ones to be standardized. We're not everyone is the same, and giving them room to to really work on together with the therapist and the patients, what gets in the way for them. And that's typically my approach is more personalized and integrative. But that doesn't mean that's always the one that's the best for that patient in the room. And so I try to adjust as best as I can to whoever's in front of me.
So highly variable, but very much worth it. In terms of other possible psychological treatments, recently we've started hearing more about acceptance and commitment therapy, which can also be abbreviated as ACT. So once again, what is acceptance and commitment therapy?
Mm-hmm. Well, ACT is coming from a third wave of CBT and integrating more humanistic values, right? And so the idea of ACT or ACT is to learn to accept your situations and uncomfortable feelings as a typical part of your life. And by accepting these difficulties, ACT focuses on your values and what motivates you, right? So even if you're experiencing something extremely uncomfortable or an uncomfortable thought or even an uncomfortable emotion, it's how psychological flexible you are to still engage in things that are important for you at the end of the day. And so it's an interesting approach. It's one that really narrows in on working through this psychological flexibility, which is a measure of how healthy your psychological state is. Somebody who says, oh, I have a good mental health is not somebody who's always happy. Necessarily, it's how easy you can move from one state to another and accept and adapt to whatever you're going through in your mind. And because ultimately we do live our lives in our minds, and so navigating it will be a measure of how well you can adapt to different stressors and situations that you're going to go through in your life.
So I had seen the term psychological flexibility in the literature pop up, and instinctively I felt like I knew what it meant, but in terms of practice, I was kind of a little bit no longer so certain. So how would you work on psychological flexibility? How can someone say, like, okay, these are the steps that I can take to increase my psychological flexibility?
Mm-hmm. That's a great question. And I often tell, the people that I work with that, psychological flexibility is like if you're always used to taking the same highway and you realize that, well, that highway has a lot of cones and there's a lot of stops and there's a lot of traffic, but it just feels comfortable because that's the one how able are you to finally take another highway, and it's a lot about taking a chance and taking a risk sometimes in your life to change. And so ways in which, we're going to work on it is, well, first of all, identifying thoughts and emotions that are uncomfortable and maybe having you become more comfortable to these internal states through, for instance, mindfulness. So you can integrate being completely present to the moment without judgment, and then moving towards things that are important to you, right? Values that are important to you. Is it your family? Is it your profession? Is it honesty? Is it, all these, and how do you still engage even if you're having low mood or even if your back really hurts? How is it that you've done one small good thing that's realistic for you in that day? And so these are one of the ways we're going to work on psychological flexibility. Can give you another example. Often we'll talk about how ashamed we are when we're feeling low and when we're not at our full physical capacity, right? And that might isolate us from the people we love, right? And if the people we love is something we want to engage in the world, right? Our interpersonal situations or interpersonal connections are so important for us, but we're sort of not engaging in that because we're feeling so ashamed about ourselves. Well, it's how do we hold the shame by the hand, right? And move towards something that's more compassionate. And often that's really hard to be compassionate with ourselves. It's easy when we're feeling good and we're, living our best life to find compassion, but it's so much more difficult when we're feeling ashamed. So how do we validate our own feelings and move towards things that motivate us and get us into this state of living the life that we want to live?
So it's accepting that we feel a certain way, whether if it's positive or negative, and still working through it, still working towards our goals step by step so that we find value in our lives again, even if we have chronic pain.
Mm-hmm.
Very, very interesting. You have a gift for metaphors. The highway metaphor was definitely helped me understand what is meant by psychological flexibility, because sometimes these terms are very abstract.
Yeah, they are. There's a lot of lingo.
Right, and it's difficult to to really understand what it would mean in my own life, in like my own context. How would I apply this? How is this relevant to me? So I think that your explanation that you gave was extremely clear, and I have a much better idea, and I have a feeling patients will also have a clearer idea of what we mean by psychological flexibility. So a few weeks ago, we had meetings at the hospital, and you sort of started discussing very, very interesting psychological treatments, and I was fascinated. And so I wanted to bring this conversation here, because I have a feeling that if even I have not heard of these things, pain patients might not have heard of these things either, and they might be very, very interested. So the first thing I wanted to discuss was flow state and pain. So that will be the overarching topic of this next segment. So what is flow state?
Well, Amanda, that's a great question, and thank you for pumping me up. Sometimes I think I say things and I forget that
we do
people
not
are listening. So, well, I think you've probably experienced a state of flow in your life, right? And so, what do I mean by that when I talk about flow? And it's something that's kind of, I think myself, being more recently attuned to this state, I would say, realizing when I'm in a state of flow and how sort of great I feel after and re-energized. And ultimately, I think this state was brought on by positive psychologists. So psychologists in this field of positive psychology, Mihaly, I can never pronounce his last name, I'm sorry, and Nakamura, they describe this flow state as a feeling of where and under right conditions you become fully immersed in whatever you're doing. And so we'll see that often in like people that'll play chess or people that'll dance, or they're just fully engaged with their mind, body, and soul, and what they're doing in that moment. And it almost feels like time has slowed down, and senses, right, there are auditory senses, our smell, our taste, everything is heightened, and we are not even realizing it in the moment because it's so effortless. It's like this effortless momentum that we're in, and I think that when we're looking at this state with chronic pain, it can be quite interesting because it can give people a really nice break from pain, or they're like, yeah, I wasn't in pain during this state, or I didn't even think of my pain, right? And so you're closing the gateway. When we're thinking about, now I'm introducing another model of the gate control theory of pain, which is in the 60s by Melzack, Ronald Melzack, a psychologist from McGill. And so, this is another way of like, how are we closing these gates that we're not feeling pain, or our perception of pain is diminished, and being in a state of flow is really, really an interesting way to get there,
So could we say that flow state is synonymous with being fully immersed in a task, completely and entirely with your whole being?
Mm-hmm. Well, I think it's really hard to describe, but I would say something like that. Yeah. If I were to choose words to describe it, right? And I think that being in a flow state is, I think language is limited in describing what it feels like, and so when you're in that state, it's like you just know. Yeah.
And how can pain be impacted by flow state, or how can the perception of someone's pain be impacted by flow state?
Well, actually, there's studies on this where, when we're in a flow state, there's executive functions, so part of the brain, and attention that are involved. So during these flow states, for example, and I'm going to say, I'm going to use a brain term here, but the dorsolateral prefrontal cortex is, the activity of that is optimized. So what that means is that your focus is enhanced and potentially reducing your awareness to your pain intensity.
Very interesting. So although your senses would be heightened in flow state, it'll be heightened for one specific task, and you'll be able to maybe ignore the intensity of your pain or ignore your pain symptoms while you're focused on that task.
Or, it's hard to say because it could be so different in how they engage in their pain and how they feel their pain. It's right. Pain is a subjective experience at the end of the day. But what I often tell the people that I work with is that, we're not going to necessarily, although, love to alleviate your pain, but we're also change your relationship with pain. And so when you're in this flow state, naturally, if you're fully immersed in this activity that you're engaged in, whether it's important to you or just the feeling is so heightened in that moment, your relationship to pain might change. And seeing that afterwards gives you really great insight on how much control we have or how much control we have over our brain by doing something different. And when you're doing something different, you feel different. And when you feel different, naturally you are different. And so that's one way in which chronic pain can be modulated by being in a flow state.
Thank you for that fantastic description of what the flow state is and how it can impact our perception of pain and our pain intensity. So still on the same vein, how can someone enter a flow state? Let's say, okay, I realize what it is. I understand. Are there steps that I can take to increase the chances that I can enter a flow state?
So research is, for instance, a lot of research has been done on athletes and being in a flow state, and has shown to decrease pain perception with neuroimaging studies indicating these changes in the different areas of the brain, and so when you're asking me how do I know, or how can I start getting into this flow state, well, I often like to say, well, what do you like to do? What is it that really gets you going in life? And some people have a hard time answering that. And so then we work on identity, right? Like, who are you as a person in the world, and what do you like doing? And if that's unclear, well, what can we take a risk on, right now? What would you like to change in your life? What would you like to experience that's maybe new but scary, but you've always wanted to try? And so getting yourself, first of all, looking inward and figuring out, well, what do you like to do is maybe a first step into accessing or wanting or intentionally wanting to get into a flow state. But and maybe I'm wrong to say this, but I would say that it's kind of a natural process, right? It's not one that I'm necessarily thinking about or that I'm telling myself, okay, right now I'm going to get into my flow state. It sort of happens naturally when I'm, for instance, if I talk about myself right now, like if I'm going to put on music and engage in either writing or what have you, whatever. It could be dancing, it could be, and so how do we can prepare ourselves from a flow state? I think it's, if you're feeling out of touch with yourself, it's maybe just starting off with just a grounding exercise and asking yourself, well, okay, what do I like to do, and how can I carve out some time right now for myself? Yeah.
You had mentioned that a lot of the times patients have trouble answering that question of what they like doing. Pain is very overwhelming. It feels like it can take over your life in some ways. And it's true that a lot of the times at the clinic here, we see that our pain patients, they no longer have hobbies because they fear the pain that it might bring, or because it's just so difficult to get out of that cycle. So taking the risk, as you said, to take an alternative highway, to have a goal, to find a purpose, in a sense, to find a hobby even, doesn't have to be as grand as a purpose. I think it can be really beneficial to their treatment.
Yeah, and I think that, because pain often robs us of the capacity to self-reflect, right? And so when I'm asking these questions, sometimes pain just takes over and they don't know. And so often we want to kind of regulate the reactivity around pain, the emotional reactivity around pain, in order to create a bit of space to be able to reflect on yourself, on themselves, in the room, and that takes time. And, I kind of want to say, if you don't have an answer right away to what do you like to do in the world, well, then do not judge yourself and go try different things, right? While respecting your physical limits and, knowing that your body is always changing. And just because you did something 10 years ago or 5 years ago doesn't mean that that's necessarily the right thing for you anymore. It doesn't mean that that's really what's working for you anymore.
Mm-hmm. It's very much true that pain is a physical experience, but it's just as much an emotional one.
Mm-hmm.
And that we
and
also
a cognitive
have
one. Yeah.
Right. And we also have to
Mm-hmm.
manage the emotional aspect of the pain for treatment in general and just to improve. So moving on to our next topic. Thank you very much for your delightful explanation on flow state and pain. It definitely provided a lot of food for thought, a lot of food for flow state.
If ever you're interested in learning more, our dear colleagues lab is doing studies on this, Sirois.
That's right, Dr. Sirois from McGill University. He focuses a lot on psychology and flow state and motivation. Very, very interesting. We encourage our listeners to have a look at anything that Dr. Sirois publishes. And now in terms of a very, very fascinating topic. This is the one that impacted me the most when I heard you speak about this, was hypnosis. You had mentioned that you had started using hypnosis for the management of chronic pain. So my perception of hypnosis is something from The Mentalist that I've seen on TV shows. I have no idea how this would be applied in real life and what that would mean for a patient. So what is hypnosis, first and foremost?
Mm-hmm. Well, Amanda, how do you know you're not hypnotized right now?
I don't. That's terrifying.
No, I think right now we're more in a flow state. I think I'm fully immersed in talking with you, and it just, I don't even know how much time it's been. But if I were to be hypnotized, I think I would be feeling a little bit more like a dreamlike state, where it's very hard to describe what it is and easier to describe what it's not.
What isn't it?
So yeah, the hypnosis, is not about being controlled, or it's not about being asleep. But it's kind of like this in-between state, like a dreamlike state, though the brain activity is different when you do, neuroimaging studies on people who are asleep versus people who are hypnotized. It's not the same regions of the brain that are necessarily activated. And so, it's hard to describe, but it's just like a really deep form of relaxation, and you're sort of in this altered state of consciousness. And I think the closest thing that people can probably recognize is, that state right before you fall asleep. You're kind of not asleep yet, but really still conscious.
Almost like a daydreaming state.
Yeah, like a daydreaming. And even when we're under hypnosis, we're still very conscious and aware of what's going on around us and where we are. And
very interesting. Thank you for that. It definitely takes away the fear of being controlled during hypnosis that we often, I feel like that's the perception that we get from hypnosis. Just that's what we see on TV and the media. So how can hypnosis be used in the management of chronic pain?
I think that's a great question, and it depends. Like any other intervention, I think it's important to take the time and assess the people that we're working with, assess their psychological state, their physical state, and see, if hypnosis, like any other intervention, is appropriate, because there's limitations to any intervention we're using in chronic pain management. And I'm very much interested in the timing and when we use what and for what, and if we can really identify what is the objective of hypnosis, right, or of any other intervention. But let's say we're talking about hypnosis right now. And so, this is I'm still in training, and for this type of complementary intervention. But I would say that really identifying what's the objective when using this technique, right? So when I'm using hypnosis, I'm integrating it into psychotherapy. I'm not a hypnotherapist. I'm a psychologist that will integrate, right, that will use hypnosis, just like one will use mindfulness, one will use CBT, thought record, right? And so this is a technique that we're going to use. And maybe a patient might say, well, my intention of hypnosis is maybe alleviating pain or creating distance with pain, and so how it works is, there's an induction phase where I'll often have them stare at a wall, and then there's these physiological symptoms, or not symptoms, but indicators that will tell me, okay, well, they're slowly getting hypnotized and they're suggestible to hypnosis. And they get into this really, this deep state, this hypnotic state, which could have analgesic effects. And so, typically it can last an hour or two even. And not everyone will experience necessarily even some pain relief, but they can bring themselves into maybe of a positive state where during the second half after the induction phase is that I'll have them get into a very positive image or visual, and this can again modulate their pain awareness. And even if it's for 60 minutes, it's again showing them that your brain can do these magnificent things and help you if you're working with it. And so then afterwards, you slowly take them out of hypnosis, and I often tell them, well, there's all these applications now. We're like in 2024, and we have access to apps such as Reverie and by David Spiegel, who's a really interesting researcher on hypnosis in the U.S. And so I tell them, to continue practicing hypnosis on their own. Sometimes I'll record my own voice to help them continue practicing. This is how I integrate it. And sometimes, as a psychologist, it's like working on pain, but we might be working on other things that are indirectly or directly contributing to magnifying pain. If, for instance, there's a trauma involved, or there's a psychological trauma involved that is really contributing to their anxiety and then heightening their state of hypervigilance, which can then keep them in a chronic pain state, right? So
the mind is both incredible and terrifying in its ability to help us or hinder us.
Yep. That is true.
And thank you very much for all of the explanations that you have given in regard to the psychological treatments surrounding chronic pain. And hopefully this information can help chronic pain patients either diminish the fear of seeing a psychologist, or just help them know what to expect when they see a psychologist and why psychological treatment might be beneficial despite pain feeling like a very physical phenomenon.
Absolutely. I think that people that have chronic pain, just as any other syndrome, is when you're that vulnerable, you want to be validated for how you're feeling. And working interdisciplinary shows us how much that is probably the first step, to treatment before you're offering them any medications or any even psychological treatment or physiotherapy or acupuncture or what have you. It is validating that their subjective experience matters, and that we're here to try to help them as best as we can, but we are also limited, right? And we can only help them as much as they're willing to change or help themselves as well.
Mm-hmm. You had mentioned earlier an app called Reverie when we were speaking about hypnosis. I was wondering, for pain patients or just for individuals who don't have access to psychologists, what resources are available to them? So we know that maybe there are some apps. Are there any that you would suggest? Is there any other resource that you think might be helpful?
Sure, there's other apps. that are available for chronic pain. There's an app called Curable that focuses on pain reprocessing therapy, which is a newer psychotherapy treatment that involves mindfulness as well. So that could be an interesting opportunity for patients that are willing to pay close to, I think it's less than $10 a month for this app. There's books on ACT, acceptance and commitment therapy, on working on psychological flexibility with chronic pain. There are, you can get access to things on YouTube, just if you're looking for psychoeducation. I think education is power, and it empowers people, because ultimately you have more awareness on what's going on in your body. And so that's one thing, it's just like, go on YouTube. There's so many free videos there, and obviously not everything is maybe research based or evidence based, but if you take the time to maybe look at research papers or articles to help solidify whatever you're listening to, or believe in whatever you're listening to, that could be another avenue, right? It's how much work are you willing to also put in. And I think that people with chronic pain are often sort of in a maze, and they go see one specialist and then they go see another, and doors get shut because often there's not that one solution that is going to help them. But it might be various solutions over time through their journey, and it's the accumulation of that 1% change that they're doing a day, with either meds or without meds, or with other forms of treatment or stretching, or walking, whatever experience, flow state activity can ultimately make a difference at the end, right? So when you're looking for that 100% solution, solution that is going to bring you an 100% relief, or even a 50% relief, well, think about again, I think we're a lot more complex than one molecule that will help us. So
a small change is still very much a valuable change, and especially over time, it adds up for sure.
Yeah, definitely.
Thank you very much, Dr. Louisia Starnino, for participating in our podcast. And thank you to our listeners for tuning in to this episode of Let's Talk Pain. And we'll see you soon.
Thank you so much.
Thank you.
Thank you for listening to Let's Talk About Pain. Don't hesitate to subscribe so you don't miss an episode, and to share the podcast with your friends. For more information, visit our website at qprn.ca or our YouTube channel by searching Quebec Pain Research Network. See you next time.